Well, let's talk now to Sheldon Yett, who's from UNICEF Sudan. Welcome to the programme, Sheldon. Thanks for taking the time to talk to us. So you have teams on the ground in Sudan. What are they telling you about the situation there?
Well, unfortunately, the situation in Darfur continues to go from bad to worse. I think many of your listeners know that the city was under siege for some 600 days. We were not able to get in food, water, basic nutrition supplies, health supplies, and then we've had this massive spasm of violence. You've seen, I'm sure, on social media, some of the executions, some of the attacks that have happened, and now we have people leaving the city. Not as many as we would have expected. We don't know where everybody is, but we do know that the atrocities of the violence they've been exposed to are off the charts.
So some of that violence you mentioned, reports suggest that that's actually being targeted against women and children. What's UNICEF hearing about that?
You know, I don't think there's anybody who's been spared by this, either directly or indirectly. Even if children aren't directly injured or killed, they have been witnessed. They've witnessed this violence. They will have these scars for the rest of their lives. The psychological trauma of seeing a family member killed or being separated from your family and walking for days to another community, that stays with you. And the scenes that we're seeing, what we're hearing, reminds me a lot of other massacres and other genocides that we've seen in the past. And this has got to stop.
And this is already the world's worst humanitarian crisis, according to the United Nations. Now we're seeing this increase in violence, more people being displaced. What are your fears about what might come next?
Well, we just heard from your correspondent about new attacks in the Kordofans. Look, all eyes are on Darfur, and rightly so, but there are other hot spots in the country as well, and the front lines continue to shift here. We know that children, no matter where they are in Sudan, are being affected by this. They've been affected by this war for over 2 years now, and it's essential that we get the resources here, that humanitarians are able to go where they need to go, and this population gets the support that it requires.
One thing that's been damaged in this 2-year conflict that started in 2023 are water systems. That's causing an increase in cholera. How much of an issue is controlling disease?
Absolutely. Cholera, of course, has spread to every state in Sudan here. We've had a huge spike in cases. Thankfully, due to the work of UNICEF and our partners, and we've been able to tamper it down, but it's not going away. Infrastructure continues to be targeted. People continue to drink unsafe water. We still need to do all that we can to make sure people have access to good sanitation and to make sure that we address not just cholera, but all the other endemic diseases that are here as well. Malaria, diphtheria, and to make sure that children are immunized and protected against these diseases that we can easily protect them against.
Reports, too, that aid convoys may have been blocked. What specific kind of help of aid is most needed in Sudan now?
All of the above. We need to make sure that children have access to good nutrition, to health care, to food, to protective services, to be safe, to make sure they know how to keep themselves safe. We need to make sure we can get holistic packages of support to communities in Al Fashar or wherever these communities happen to be.
So this is a conflict that, as we've said, has been going on since 2023. How important is it that the eyes of the world don't look away from what's happening in Sudan?
Well, unfortunately, the eyes of the world have ignored Sudan. Given the state of this crisis, given that this is the largest humanitarian emergency in the world, I've been shocked how little attention there really is to the crisis here. And if we don't pay attention to this crisis, it's going to continue to grow. The needs will continue to increase. And the cost to all of us, the cost to children, will be enormous.
Sheldon, great to talk to you. Thanks so much for joining us on the programme. That's Sheldon Yett from UNICEF Sudan.